you for joining us for Integra's presentation. We're going to be talking about fall prevention, how to prevent winter slips, trips, and falls. You have two of us here presenting today. Myself, I'm Shannon Dales. I'm a doctor of chiropractic, and I'm Integra's lead for wellness and rehab. And I am joined by our lovely co-host here, Rachel Carson, who's one of our registered physiotherapists here at Integra. So we're happy that you've joined us for this presentation today.
Perfect. So I just wanted to start by talking about why falls prevention and why this information in today's talk is so important. Falls are very prevalent in our community. So it's actually found that 1 in 3 people over the age of 65 will fall each year, and those who have fallen once before are actually more likely to fall again. About half of the falls happen at home. So a lot of the strategies we're going to talk about in today's presentation are going to be helpful for mitigating the risks of falls within the home. Falls can result in serious injury and hospitalization, which is obviously something that we want to avoid. Also, the fear of falling can lead older adults to withdraw from activity. So that can not only lead to a decline in physical fitness, but also a decline in cognition and mental health. So the fear of falling and the fear of movement is something that we want to kind of avoid as we get older to keep our older adults engaged within our community. And then most importantly, a lot of falls are preventable. So we'll give you some strategies and some exercises that you can try out to hopefully mitigate our risk of falls.
So we're going to review some intrinsic or personal risk factors for falls. This list is fairly general, but I'm sure everyone can find a spot which may apply to them. First one, if there's any muscle weakness, and it could be from a recent injury or chronic injury, but especially any weaknesses around the hips, knees, and ankles. Anyone that has impaired balance and mobility, that's not quite as steady with walking, and certainly anyone that uses any walking assisted device for sure, that can have an increased risk. People with sensory impairments, namely vision, vestibular, which is the balance receptors in our ears, and proprioception, which are receptors in our joints, primarily in the ankles and feet, that will give us a sense of balance around us. So any impairments with those can increase risk for fall. Certainly any cognitive impairment, any chronic conditions such as Parkinson's, stroke, diabetes, any cardiovascular issues as well. And a big one is medication side effects, sedatives and polypharmacy. An example, my husband was on blood pressure medication, and he, first time on it, got up too fast and then just boop, fell over and just really injured his ribs. So it doesn't matter how old you are, medication side effects are a real thing and can lead into some fall situations.
Now I'll talk a little bit about extrinsic or environmental risk factors for falls. So these are things that are in your environment. They're less specific to you as an individual, but things that we encounter in our day-to-day. So the first one, poor lighting. So that could be, dim street lights or a poorly lit room. Clutter or tripping hazards. This is more specific to in the home. So loose rugs, boxes or clutter left on the floor, narrow spaces that are hard to navigate. Those obviously increase our risk of falls. Inappropriate footwear. So that could be, your slippers that don't have a supportive heel that you can easily slip out of, shoelaces that aren't tied, any footwear that's not stable for our feet, something that we want to be, aware of. Slippery or uneven surfaces. This is especially relevant to our upcoming winter months when we have snow and ice to watch out for. So we want to make sure, we're cognizant of our slippery surfaces that we're walking on and on the sidewalks especially. Inadequate assistive device use. So that is if you have a gait aid and it's not measured to fit you exactly right, or maybe you're not sure how to use it, that can obviously be a risk for a fall. Like I mentioned before, previous falls history. So if you've fallen in the past, you are at a increased risk of falling again. And then alcohol consumption. Alcohol obviously impairs our balance, our reaction time, our stability on our feet. So, mitigating that risk in moderation.
So let's talk about some strategies to prevent falls. Number one, we stress is staying physically active. Regular exercise makes your muscles stronger and your joints function better. Weight-bearing exercise in particular is good to increase our bone mass to help prevent a fracture if you do fall. So the message is exercise, lift heavy if you can, put as much muscle mass as you can to create stability. Get regular hearing and vision tests. Even small changes in these senses can increase your risk for fall. So it's important to check in with your health practitioners regularly for this. Review medication for side effects. Consult your medical doctor or your neighborhood pharmacist if you experience dizziness. And it's good to know what the side effects are so you can reduce. Get plenty of sleep. This seems like an easy one and hard at the same time. Your coordination is greatly reduced with less sleep. So trying to get nice, deep quality sleep is important. And standing up slowly. Standing up too quickly, changing positions too quickly can cause your blood pressure to drop, making you feel wobbly. So when you wake up in the morning, it's advised just to sort of sit at the side of your bed, take a moment, take a couple deep breaths before you just hop out of bed and start your day. We find that this is especially important for our aging male population. It seems to be a bigger issue for that group, but I think it's probably good advice for everyone.
So some other strategies, things that I've already mentioned before, but proper use of an assistive device for movement. So making sure that whoever recommended or prescribed you, your cane or your walker, making sure that that is properly fitted to you, and then making sure you're taking it to where you're going. So not forgetting it on at home when you're going out into the community. And also if it's necessary for you to use it within the home, making sure that you have enough space to navigate through your home with a walker. A lot of people like to do what we call furniture surfing, which is grabbing onto furniture to keep balance. That's something we want to avoid because that's not the most, steady way to keep our balance. And so if you do have a assistive device, making sure that you're using it properly inside and outside the home. Also wearing appropriate footwear. So like I mentioned, those slippers that don't have a closed back sometimes can be a falls risk because they can slip off your feet. Especially in the winter months, we want to have footwear that has some good tread to keep balance over snow and ice. And then, other things like making sure that our shoes are tied and making sure that it's stable on your foot. And then the last one is limiting alcohol consumption. So, like I mentioned, alcohol, even in small amounts, can affect our reflexes, our balance, and our sleep quality, like Shannon had mentioned. And alcohol actually affects your bone density. So, that can increase your risk of a fracture if you do fall. So, you want to make sure you're practicing that in moderation.
So how to make your home safer? Well, keep your path clear. Make sure all the hallways, stairs, and rooms are free of clutter. I find that this holiday season, it's amazing what the extra items we have between rolls of wrapping paper and ribbon. So just try to keep your path clear as much as you can. We want to remove environmental hazards, just cords, loose rugs, clear the walkways of snow, ice, and leaves. Very pertinent for this winter here. I'm being mindful of the curbs, stairs, wet floors, and uneven surfaces. As we are connected to the path here, I've had many patients have wiped out when people are trudging through from outside, whether it's wet or snowy, and some of those floor surfaces can be like an ice rink. So really watching the path underground when it's any wet conditions. And of course, my biggest pet peeve is walking and texting with your head down. So try to keep your head up, your phone down, and hopefully that'll be a little safer. And making sure your home is well lit. It's important, especially if you're planning to get up at night, that you have your pathway to the bathroom well lit as well. Keeping things that you use most often in the kitchen, in the bathroom, within an easy reach. So between the shoulder and the hip level, we're trying not to have to bend too far forward or go up too high. Just keep it nice and easy will prevent falls as well. And before you leave the house, check the weather and dress appropriately with footwear especially.
Okay, so before we start to talk about some exercises that can help improve our balance, I just wanted to touch on the three systems in your body that actually help you stay balanced. So the first one is your vestibular system. So this is what helps you sense motion, helps sense changes in your head position. Most commonly, we think of this when there's an issue in our vestibular system. We have those symptoms of dizziness, spinning, and vertigo, and that's when we know something's off in that inner ear in those sensory receptors. The second one is proprioception. So Shannon mentioned this before. This is found in your joints. These receptors help send signals to your brain that help tell you where your body is positioned in space. A good example for this is I'm able to close my eyes and touch my nose with my finger without looking. I don't need any visual cues. That's helpful. That's because of our proprioception, and I know where my body is in space. And then the last system is your visual system. So that tells you kind of where you are, what's going on around you, what hazards are in the way. So these are things that help you prevent falls. But all three of these systems are actually working constantly together to give your brain the right information about your body and the world around you. So when we're training balance, we actually want to challenge one of these systems to help strengthen the other one's abilities to adapt and get stronger. So an example of this, if you think of a balance exercise where you're standing with your feet together and your eyes are closed, we're taking away our visual system. So we're forced to use our proprioception and our vestibular system to maintain that balance. Similarly, if you're, standing on one leg and you're practicing that as a balance exercise, we're taking away some of that proprioceptive feedback, and we're, having to focus more on our visual system and our vestibular system to keep us balanced. So this is good information, especially in physiotherapy, because we can, target specific systems that maybe need more work. So, if someone comes in and tells me that they only feel off balance or they only fall at night when all the lights are off and they're getting up to use the bathroom, maybe that's because they're more dependent on their visual system to keep them balanced. So in physiotherapy, maybe we want to work on strengthening that vestibular system and proprioception to kind of help so that they don't only rely on vision to maintain balance. Or kind of like what Shannon mentioned, you can also adapt the environment if you know what strategies you use most. So that would be, leave the lights on for yourself. So if you're getting up in the middle of the night and you use your visual system for balance, give yourself, the upper hand by having a clear route for yourself that's well lit. But it's just important to kind of know these are the three systems at play, and especially then you can think of what you're working on when you're doing balance exercises. Good.
Oh, here we go. So, was made a little video in Integra's gym here of some easy exercises that we can do to improve balance. Some of these I do quite regularly. So they're not too difficult. We'll probably go through this video a couple times because I went through it fairly quickly, but you get a good idea. None of this requires any equipment, just simply some space. I think there was one that used a towel, so something that everybody has at home. And again, we want to make sure it's safe and appropriate for anyone. Let's give it a roll. Let's see what we see here. So first, we're going to start off with some heel raises using both feet at the same time. And then I'm going to go into a single. But you notice I'm using a chair to steady myself. You can use a cupboard, anything around. Next, we're going to be going into heel toe walk. And again, I'm doing this with eyes open, but you could try this with eyes closed. It would just be a lot more challenging, and you'd probably see me a little less steady as well. So if you're doing it with eyes closed, again, making sure that your environment is going to be safe for doing this exercise. All right. Oh, I think we actually go back to the video here. So again, the double leg heel raise. We went into the single leg heel raise. And then we went into the heel toe walk. after this one. Now we're going to do some heel toe. Normally this would take longer, but we're just kind of going through it. And backwards. There's a little extra spice there. And this one is just simply standing on one foot. Again, I'm not doing it with any assistance, but you could hold on to a wall with a finger, and I'm holding that leg up just for a couple seconds. This one is just a modified squat. So if you do squats on your own regularly, great, tick that box off. For those of us that don't and don't know how to start, this is an easy way to do it. It's just grabbing a chair. And you want to squat down almost in the same action like you would lower yourself to a toilet. So instead of when you go to the toilet, your hips come back, and that's the type of action that we were looking for there. But getting your hips stronger, they're big, big muscles, and that can really help prevent falls. Or if there's a little unsteadiness, you can engage that pelvis and leg quickly. So while the sit to stand, very useful, I think getting stronger, most of us have to focus on that. And lastly, in this series, I'm doing a little side slide with the towel. Now, this one I'm definitely hanging on to a wall or a chair. You're going to be practicing some strength on one side, and then just being able to steady yourself when the leg is coming out. It's important not to lose control of that towel. So you don't want to go as far out as you possibly can, just out enough where you can sort of feel your inner thigh being a little taxed. But I don't have to do a lot of these to get a workout. Even if you did each one of these 5 times, like it would only take you 5 minutes to do these. And whether that is just peppering it in through your day, peppering in after your workout. Most of us forget to add some of these balance exercises, especially important, which we might have mentioned earlier, but anyone who's got a history of any ankle injuries, inevitably the heel raises are a really great strengthening exercise because we tend to be a little weaker. And as Rachel said, once you fall once or once you sprain your ankle once, you're at more risk for doing it again. So there's multi-purposes for working on some of these balance exercises, including fall prevention. And we will also, if you're interested in getting a list of these exercises, just reach out to us. Rachel and myself will be happy to provide a handout with all of these exercises broken down for you as well.
Okay, so we mentioned a lot about how to prevent falls. But I think it's important to address that what happens if you do find yourself on the ground. So first and foremost, if you do find yourself on the ground, you want to make sure that you are not injured or hurt in any way. So you want to make sure you don't have any pain or any injury. If that is the case and you have hurt yourself, the best, line of defense is to, call for help, call 911, use your emergency button, whatever it is, rather than trying to get up. But if you find yourself on the ground and you're not hurt, the best strategy is in this video on how to get up. We'll play it a few times. I'll try and talk over it. But if you're starting on your back, we can kind of go into that log roll by bending that leg up. Then you can bring yourself into kind of on your hands and knees. And then you go and you can crawl towards what you want to be a stable surface. So, a stable chair, a stable couch, something that can support you. Oh. So again, log roll there onto my side. Then I'm able to bring myself onto my hands and knees. I can crawl towards a stable object. Then I want you to prop yourself up on that object and bring your stronger leg, that stronger foot, up beside you. So when you go up on one knee, if you have a side that's stronger, you bring that one up first, and then you can kind of use that leg and your arms to kind of help prop yourself up onto the chair nice and safely like I did there.
Wonderful. Rachel and I are here to answer any questions you might have. If you do fall and find yourself injured, obviously we here at Integra are here to help, Rachel and myself and the entire team. So if you do find yourself in a case of a fall, and again, falls happen at any age. They can be young, they can be middle-aged, they can be older age. So it happens to all of us and it happens quickly. So we're here to help if there's any injuries. You just have to reach out to us, and we will do our best to get you feeling better and moving better as fast as we can. We're good.